at someone constantly, that could result in injury over time. Okay, some examples would be an acute ionizing radiate or UV radiation can be classified as an acute stimulus. It can also be classified as a chronic stimulus. Here's just someone who was out in the sun and got a sunburn as a consequence of that intense exposure to the sunlight. Or over time, someone could develop some kind of skin cancer that's related to, long-term exposure to the sun. Or here's a case where someone, construction worker, fell down while doing some kind of patio or deck work, and the tooth broke. It was a one-time fall that triggered this injury. Or, here's an avulsed tooth there. But here's also an injury to the teeth that doesn't happen with a one-time stimulus. This is abfraction. This is someone who's maybe constantly grinding or clenching and creating this wear over time. Or on the incisal ledges or occlusals is creating this mechanical wear, which is attrition. So abfraction is shown above while attrition is shown below. Another way to classify injurious stimuli is whether they're intrinsic or extrinsic, or in other words, endogenous or exogenous. So intrinsic is what's produced within the body. It originates within the body, or it's endogenous. And this is injurious stimuli that are related to genetic factors, gene defects, defects in the chromosomes. Those are intrinsic in nature. Extrinsic originate outside of the body, or they're exogenous, and they're related to things in the environment. Under embryology, we talked about various teratogens that can affect our normal development. Again, we could just say stimuli can be prenatal or postnatal, during development within the womb or after birth. So just showing you defects in the enamel, the consequence of an injurious stimulus. The picture on the left is an example of genetic factors that resulted in this. It's called amelogenesis imperfecta. And on the right-hand side is a more severe case of what's called enamel hypoplasia, which was triggered by something in the environment during tooth development. The the person may have been affected by high fevers that disrupted the ameloblast, a nutritional deficiency, or even too much fluoride could have triggered this.
Could you tell me, where are we on the outline?
Page 5.
Oh, mine doesn't have page numbers, which is why I'm confused.
Should say at the top, types.
Types of what?
It says types of injurious stimuli, agents of disease, general, acute versus chronic, intrinsic versus extrinsic, and B is specific.
Oh, I see it now. Thank you.
Okay, so now getting to more specific types of injurious stimuli. Obviously, the genetic disorders are the intrinsic ones, where the subsequent categories are extrinsic. And again, some of these injurious stimuli could actually be predisposing factors, such as a genetic predisposition to a disease, but it still would take something in the environment to trigger it. So let's briefly look at genetic disorders. Genetic disorders can be classified as single gene disorders, affecting one gene. On the other hand, there are also polygenic disorders where you have a genetic package overall that predisposes you to a disease. And then there are some genetic disorders that are classified as chromosomal abnormalities, such as Down syndrome. So I'm just going to mention an example of each. So one example of a single gene disorder is hemophilia. It's a genetic defect in clotting factor number 8. And so these individuals have to have replacement blood transfusions and medications to help with their proper blood clotting. Polygenic disorders, like I said, means that you inherit a genetic package, not just one gene that's passed along that predisposes one to a disease. And examples of this that, diabetes, a predisposition to developing diabetes does run in families, and certain cancers. Again, they're sometimes, cancer, like breast cancer, there has been a specific gene identified with it, but there are just also polygenic factors predisposing individuals to cancer. And then an example of a defect in chromosomes is what's called trisomy 21 or Down syndrome, where the patient has an extra 21st chromosome. And some of these genetic diseases could just be a result of a spontaneous mutation that occurs in the individual in the womb. It's not necessarily something that's passed on from one generation to another. Another syndrome is Turner syndrome, and then this is affects females where their X chromosome is missing or partially missing. And then another one I showed you before was the Treacher-Collins syndrome, where the neural crest cells fail to migrate properly, and that's actually a defect in chromosome number 5. And this could be, this shows a father with his child, that it could be passed on from one generation to another, but it also could be the result of a spontaneous mutation. We're not going to get into too much detail about genetic disorders, just be covering a few that have, oral manifestations. Okay, physical injuries are widespread in our world. They can be subclassified as mechanical injury or trauma, temperature extremes, ionizing radiation, non-ionizing radiation, under electromagnetic fields actually falls under non-ionizing radiation. Okay, So let's look first at mechanical injuries. And I just want to point out again that the photos or the examples I give you are not the injurious stimulus itself. It's actually the effect or the consequence of the injurious stimulus. So just this cartoon that shows the hammer is the injurious stimulus, but what happens to the thumb is the effect. Okay, so here this person could have been hit in the mouth in a car accident, fallen down. That's the injurious stimulus, but the oral cavity is subject to a lot of wear and tear, or in other words, a great deal of trauma or mechanical injury. Here I showed you that person who had a fall also and broke this tooth in half, or avulsed teeth that are knocked out of their normal position that can be reimplanted successfully. So again, these are the consequence of these mechanical injuries. So I've shown you some examples of the teeth. Again, attrition from clenching or grinding over time. We can see this mechanical wearing away of the tooth of the incisal edge or occlusal surfaces. Or we can see this wear at the cervical area as well on the teeth. And not only are the teeth subject to mechanical injury or trauma, but also the oral mucosa. Seeing petechiae on the buccal mucosa is extremely common in your patients when you're doing the oral examination. Here's a patient who traumatized the alveolar mucosa area from overzealous toothbrushing. Even this is from an improper fitting denture. This is just the denture fits right in here, and there's this overgrowth of tissue that occurs that's called an epulis fissuratum. Even individuals who gnaw on their cheeks can cause some damage. Here's a sloughing tissue from someone who just has a habit of gnawing on the cheeks, and sometimes it can go pretty deep and expose the underlying connective tissue vascularity. And then last semester, I also mentioned that salivary glands can be injured. Trauma to the lip can create what's called a mucocele. What happens is the duct from the minor salivary glands in the submucosa of the labial mucosa is damaged so that the saliva pools out into the connective tissue, and you get this little vesicle or bubble called a mucocele. All right, so there's a lot of wear and tear that can occur in the oral cavity. What about temperature extremes? So we can have hot or thermal or cold. And in the oral cavity, it's, you're not going to have an injury from extreme cold. It's going to be more hot in nature. So these are just examples of thermal burns. Here, this one was supposedly from hot soup that the patient ingested. This one on the right is a classic pizza burn, you know, the hot cheese. It's common to see burns on the palate, even though it's a pretty tough tissue. And then the heat from smoking can cause changes in the palatal mucosa as well as the opening of the ducts of the salivary glands. All these red areas are inflamed orifices of the ducts of the palatal glands. And the clinical condition is referred to as nicotinic stomatitis. Again, the injurious stimulus is the heat from smoking. This is just a picture of what can happen from extreme cold, frostbite, and again, there wouldn't necessarily be manifestations just in the oral cavity. Okay, again, you don't have to know this, the electromagnetic spectrum, but it kind of shows you the different kinds of non-ionizing radiation and the types of ionizing radiation. And these larger waves are given off from electrical devices. And then as they get smaller, we get into ultraviolet light. Some of it's classified as non-ionizing, some of it's classified as ionizing. And then X-rays, you know, which you'll be generating when you take dental X-rays, are shorter wavelengths, and then gamma rays can be our nuclear radiation, you know, that's seen in produced in nuclear power plants or during nuclear accidents. So we're going to see that some of these non-ionizing and ionizing radiation can be injurious stimuli. Okay, you're going to have a whole topic in your course about exposing X-rays and then the safety measures that you follow in order to minimize the amount of radiation to your patients. You know, our patients wear lead aprons. We protect their thyroid with a thyroid collar. You know, radiation, X-radiation has been associated with thyroid cancer, for example. Also, when X-radiation is used for treatment of cancer, it can be damaging to our normal tissues. Here's an example of a patient who had radiation therapy as a cancer treatment and resulted in this injury to the oral mucosa. It's called radiation mucositis. Nuclear radiation, some of those, the ionizing radiation that's given off from those things can be very detrimental. Many people died from this. You can see the radiation burns on this child. Many people develop certain cancers associated with nuclear radiation, such as leukemia and lymphomas. This also happened when Japan was when it was bombed in World War II. So nuclear radiation is also harmful. I just wanted to mention briefly radon gas. This is something that's generated naturally in different areas, and it actually can, if it's underground under your house, it can actually get into your house, and it's uh, known to be the second leading cause of lung cancer. So some people have radon gas detectors in their homes. Another tragic story that has to do with ionizing radiation was in the 1920s. You know, when radium was discovered, there were a couple of factories opened up in the United States, and you know, women were hired to work, and they created all these different products that glowed. For example, these kind of alarm clocks and watches. And you can see this woman here painting this. They used to all you know, dip the brushes on their tongues, and they even, like, you know, put it on their clothes and faces, because then they would glow in the dark, because they didn't know the harmful effects. But this is a lot of these women had serious illnesses, including, you know, certain kinds of cancers from being exposed to this. And there is a book called The Radium Girls, and it's a real interesting story if you ever get a chance to read a novel. And today, you know, we have OSHA, and it's because of how this was mismanaged, all these women in the 1920s, and that OSHA was established. I also heard there's a movie of this on Netflix that just premiered, if you have that. All right. Ultraviolet light, another name for ultraviolet light is actinic radiation or solar radiation. And ultraviolet light consists of both ionizing and non-ionizing radiation. And already mentioned the effects that too much sun can have on us, from a sunburn to long-term sun damage, such as developing skin cancers. And, you know, this is just showing what, you know, just remember when you're outside to use sunscreen, and also on your lips too, because there is a premalignant condition that can affect your lips. People that work outdoors or are constantly outside and don't protect their lips are prone to this condition, this damage from sunlight. Okay. Electromagnetic fields, again, going back to the electromagnetic spectrum, these are fields that they're actually a type of non-ionizing radiation, but their EMFs are electric and magnetic fields that surround our electrical devices. And I just wanted to list some of the everyday sources of EMFs: power lines, electrical wiring, microwaves, computers, cell phones. And there have been, I'm not telling you that they cause cancer, but there have been some correlations or associations of these with incidents of cancer. For example, there have been some studies that show an association of living close to high voltage power lines and, for example, one cancer called leukemia. Again, I'm not telling you that these cause cancer. There's just been some studies that show this association, a correlation. And you may have heard before when cell phones first came out, they were saying that it caused brain cancer. And the World Health Organization even issued a statement that it might. But again, there's just this possible association. Okay, so those are all physical trauma to the different forms of radiation that are classified as physical injurious stimuli. Let's go next to some chemical examples of injurious stimuli. Tobacco, alcohol, various drugs and medications, and acids can be cause injury. So here's an example of oral tissue response to tobacco chewing, which it is classified as a carcinogen, an agent that causes cancer, and it can cause oral cancer. This is at the point where it's just created what's called a smokeless tobacco lesion. Here's an example of a patient who has oral cancer on a smoker who has cancer on the lateral borders of the tongue. It may be linked to esophageal cancer, although a significant number of esophageal cancers are linked to acid reflux, the stomach acids regurgitating up into the esophagus area. We've already talked about different drugs that can affect babies prenatally, and I mentioned to you in oral histology the thalidomide. This was something that was used to treat morning sickness, and it resulted in widespread birth defects. Here's an example of a patient who put an aspirin on the cheek. There, here you can see part of a bombed out tooth right here. Aspirin is acidic. It may have helped the toothache, but it actually, being an acid, burned the tissues. So this was like a topical injury. Oh, I thought that, okay. And then here is a patient who has gingival enlargement from taking Dilantin for epilepsy. And just going back to this slide, I was thinking this was a different slide that I have because it could look just like an aspirin burn, but it's not. This was actually someone who had cancer chemotherapy, and the most common oral manifestation of cancer chemotherapy using drugs to treat cancer is oral ulceration, and here are all those ulcerations there. And just ingesting tetracycline during tooth development as classified as an injurious stimulus. This is where the tetracycline was taken up in the dentin and can be seen through the enamel. And this was the aspirin burn I was talking about earlier. Here's Here's the bombed out tooth, the topical application of the aspirin, and the consequence is the aspirin burn. Okay. Acids, as I mentioned, can be injurious. A patient who was sucking on lemons constantly, like it was not just a one-time thing. This would be an example of a chronic stimulus, sucking on the lemons and resulting in erosion of the teeth. A patient who has bulimia, who is vomiting, that also can erode the teeth. And then again, I mentioned about the acid reflux, the patients that have these chronic stomach acids irritating the lining of the esophagus can actually create a condition which we're going to talk about further. It's called Barrett's esophagus, and some individuals that have Barrett's esophagus will actually go on to develop cancer of the esophagus. Okay, any biologic injurious stimulus just means it's a pathogen, a microorganism that's a pathogen. So microorganisms in our plaque biofilm that you're going to learn about in perio, creating gingivitis, periodontitis, caries. These are all biologic stimuli. And any pathogenic microorganism that causes some kind of infection, for example, strep pyogenes, that causes strep throat, those are all biologic in nature. Like I said, we're going to talk about many infectious diseases that affect the oral cavity. So we already know, seen this many times, how the specific plaque biofilm can create gingivitis. Here's a person that has the oral manifestations of the herpes simplex virus. And they get a primary oral herpes infection as shown. And then here's, I showed you this before too, how the bacteria, this is the bacteria that causes syphilis, can result in manifestations of congenital syphilis, including malformations of certain teeth. So viruses, bacteria, and even fungi. I talked about, last week I talked about thrush a little bit as an example of an infectious disease. So all of these different types of microorganisms are classified as biologic stimuli. Okay, last week I mentioned different nutritional diseases, while the injurious stimulus is the nutritional imbalance. Is there a deficiency in the nutrients, or is there too much or an excess of these particular nutrients? So what's listed here is the specific injurious stimulus. So for example, I showed you, this is an these are some manifestations of an iron deficiency resulting in what's called atrophic glossitis, which just means that there's loss of the filiform papillae, smooth tongue, and the cracking and at the commissures, this burning, cracking at the commissures is called angular cheilitis. And then last week I just mentioned that an example of an excess of nutrient is like if someone takes too much vitamin A, they can end up with hypervitaminosis A. Okay. Another category of injurious stimuli relates to oxygen. If you see that root word oxia, that relates to oxygen. And in order to survive, our tissues have to be properly oxygenated. Well, when there's a complete lack of oxygen, that's called anoxia. And an example of this would be when the coronary arteries are blocked and no oxygen is getting to the heart muscle, and that creates a myocardial infarction. To a lesser degree, the term hypoxia refers to a decrease in the oxygen to the tissue. So sometimes some patients have a condition called angina where their heart muscle, their coronary arteries may be partially blocked, and then they block when the person exerts himself or is stressed out. It may cause greater constriction of the coronary arteries, and there's like a temporary decrease in the oxygen to the tissue, and they get chest pains. And this is in general referred to as an ischemia. We'll distinguish between these two momentarily, but I just want to focus on the injurious stimulus or the snowball. Either lack of oxygen, which is anoxia, or hypoxia, which is decreased oxygen. Okay. Last week I mentioned that there were quite a few immunologic diseases that we'll be talking about in the course. And just to reiterate what the injurious stimulus that relates to an immune mechanism and the example of the effect or the consequence. So with immune mechanisms, we can see a deficient immune response is the injurious stimulus. And at the other end, it could be an overactive immune response. or it could be one that's misdirected. And finally, there are some that fall under there's an immune mechanism, but it's not entirely clear what's happening in the tissues. So the effects or consequences are actually immunologic diseases or conditions. So like someone that has a deficient immune response, such as in HIV infection, because their immune response is deficient, they're prone to infections and certain cancers. Not all cancers, but certain ones. When the stimulus is an overactive immune response, the best example I can give you is allergies. When our body, our immune response goes overboard in response to substances that are harmless. So latex, pollen, ragweed. Misdirected is when the immune response attacks one's own tissues. So any autoimmune disease would fall under this, such as rheumatoid arthritis or multiple sclerosis, lupus. And then a very common condition in the general population, which the mechanism is not completely understood, are aphthous ulcers or canker sores. So to reiterate, the injurious stimulus involves an immune mechanism which can be categorized as one of the four on the left, and the effect or consequence, the pathologic condition, is stated on the right. So here, this is just showing you, this is just a manifestation of AIDS, showing you the latex allergy, showing you the damaging effects of a misdirected immune system on the joints of the hands. And this is just your canker sore that develops in some individuals. So there are also what are called emotional stimuli, just a very, something that can really impact your life, can lead to injury. Like, they have the saying that a person died of a broken heart, or this stress of losing a job, loss of a pet, can be a stimulus for various injuries. This whole COVID, the pandemic, can be a stimulus for different things. And it's just not physical conditions like hives, rashes, ulcers, but it could just be cognitive effects, depression, and so on. And some of these emotional stimuli may just be more like predisposing factors. For example, I mentioned this disease that we'll be talking about called lichen planus that has oral manifestations, and it's linked to an unclear immune mechanism, but it can flare up from emotional stimuli. Okay, and now, it's beyond the scope of our course to talk about the aging process, but this kind of is like what comes first, the chicken or the egg, and I'm not here to support one view. I'm just letting you know there's two sides of the coin here that you can say, does aging cause or predispose one to injury or disease? Or there are others who would say that aging is the consequence of injurious stimuli. All right, so we've gone over a whole host, wide range of various injurious stimuli. Why don't we go ahead and take a 10-minute break, and then we're going to finish off with host response to these injurious stimuli.